Hello everyone, my name is Janvir Kaur. I'm a student of Sanaka College and right now I'm studying nursing leadership and management. So, today I'm going to share the learning outcomes for 3 weeks, which are 2, 3, and 4 under the course Nursing Leadership Management. As we all know that technology is emerging in every sector, which includes health sector as well. In hospitals, technology plays an essential role to provide proper care and treatment to patients and also prevent them from such severe problematic situations. Moreover, in week 2, I gained proper knowledge about nursing informatics and its significance. It is one of the strongest tool which provides nurses to play their functions properly and perform their responsibilities accurately. So, if we talk about the definition of nursing informatics, it can be defined as it is a science and practice that integrates the nursing with information and knowledge, with management and communicational technologies to promote the health of people's families and communities worldwide. Whereas in the other hand, health informatics is broad term. It is interdisciplinary field that combine information science, healthcare, cognitive science to manage healthcare data with information. The purpose of healthcare data is it is helpful to familiarize the nursing and health informatics. How nursing informatics is helpful in today as well as in the future. So that's the question that is most asked question in ever. Therefore, nursing informatics plays a role of foundation skills which provide helping hand in the assessment and maintenance of patients' data in an accurate way. For example, it includes lab test, medicational history, surgical history, and medication chart, etc. It promotes better time management for nurses and reduce stressful errors in the hospital environment or among patients. As now there is no handwritten documents which are mostly hard to read by many people, which also lead to conflicts for nurses, patients, or delayed time management skills. And sometimes it can be leads to conflicts among patients and with their co-workers. So, by the help of technology, maintenance of electronic health records elevated the better quality care to patient and build better nurse-patient relationship as well. Nursing informatics is linked with patient safety and quality, such as nurse can access the client's electronic healthcare information anytime to check any severe problem like allergies, drug interaction to patients. So all the information is highly important for current and upcoming nurse leaders in order to serve holistic care to patient. Moving forward to week 3. In week 3, I have learned the overall view of nursing information in Canada and different organizations working in the Canada for information assessment in CNA and CASN guidelines. So CNA guideline is its full form is Canadian Nursing Association that support the adoption of single clinical terminology which is appropriate to healthcare Canadian system and values. On the other hand, if I talk about CSN's full form is Canadian Association of School of Nurses, which has published enter to practice informatic competences for nurses, and while entering to practice in workplace it helps nurses to know the gap and enhance lacking the knowledge and enhance their skills, thus improving clinical system. Afterwards, in week 4, in week 4, it describes the information regarding the most useful gadget which we all use for different purposes. And this gadget is also made our life very easy. And it by the help of this gadget we can easily perform any activity in less time period. It gives overview description of main components of computer such as central processing unit, that's CPU, as well as input, output and storage devices. Understanding of computer influence our nursing leader skills of our future and to work more efficiently in complex setting. Therefore, knowing a feature of computer for nurses is very much important to become proficient in use of technology. Like it can be very helpful in every circumstances, whether it can be related to maintenance of records and reports of patients, or it can be related to any study of disease conditions to find out the proper treatment regarding this. With the better understanding of computers, nurses can easily retrieve, organize, and manage data and information. So, the nurse leaders, both now and then in the future, are able to provide guidance, incorporating technology to bring some changes in practice that will ultimately enhance patients in practice, that will be able to provide knowledge regarding every conditions and economic outcome through improving health population and reducing the cost of healthcare as well. That's all about my learning which I have learned during 2, 3 and 4th week. Thank you so much for watching. I hope you understand which I tried to explain in my video. Thanks again.